So Laura, do you know the difference between leukemia and lymphoma?
I know that they're both part of the Leukemia and Lymphoma Society.
Okay, well, that doesn't really help much.
But I do know that there's got to be something similar to them, right?
Right. And these are just the kind of hard-hitting questions that we bring to the Washington University physicians that we have on this podcast. But
questions like, I don't get it.
Yeah. What does that mean? Is that bad?
Yeah. Why do they call it non-Hodgkin's? I think you said, what's up with that Hodgkin's guy?
Yeah. I'm not, I'm a podcast guy. I'm not an oncologist.
But I do love kind of the juxtaposition of where we sit in this podcast booth, because we're just like everybody else, every other patient that walks into a hospital and has questions. And the doctors that we sit down with really do have a great way of helping you understand such a complex disease.
Yeah, spoiler, I did not know either.
Did you know it was a blood cancer?
I knew that.
So no.
I knew that one of them was.
Okay.
I know Anthony Rizzo, who's he used to play for the Chicago Cubs. He's one of my favorite players.
Yes.
I know that he had lymphoma. Or was it leukemia? I don't know.
See, that's the thing. People don't know the difference between lymphoma and leukemia, and there is a clear difference.
There is a clear difference. And when you listen to our show, This is Cancer, brought to you by Siteman Cancer Center at Barnes-Jewish Hospital and Washington University School of Medicine in St. Louis.
The national leaders in cancer.
Thank you. We get to ask these Washington University physicians, what's the difference between leukemia and lymphoma? And then they go, well, actually, let's
explain it.
Let's explain that to you. So this conversation didn't originally make the episode, and that's why you're getting another bonus episode on the difference between leukemia and what is
lymphoma,
it?
Patrick.
Lymphoma. Here you go.
Joining us now are Drs. Maria Thomas, who's a radiation oncologist at Siteman Cancer Center, and also Dr. Neha Mehta Shah, who is the medical oncologist for Justin and also specializes in lymphoma. So thank you both so much for coming here.
Thank you for having us.
Yeah.
Absolutely.
Could you describe to us what you do at Siteman and how you two worked together?
Yeah, so I'm a medical oncologist, which means I'm a internal medicine doctor who then has learned how to give medicines to treat the cancer throughout the body. And in lymphoma, most of these diseases, as we mentioned, because the cells it comes from are programmed to go throughout the body, there's a large role for medicines in the treatment of lymphoma. So that can include chemotherapy medicine, so medicines that kill dividing cells. There can be targeted medicines, that can be immunotherapy medicines or medicines to boost the immune system to fight the cancer.
And Dr. Thomas, what about you?
Yeah, so I'm a radiation oncologist, and so radiation oncologists have a different training program. So the radiation oncology training does train a physician to treat many different cancer types, but then at larger institutions or practices, then radiation oncologists often do subspecialize. So I treat patients with breast cancer and lymphoma.
Dr. Thomas, can you help us understand the differences between lymphoma and leukemia?
Sure. Yeah, and they're kind of grouped because they are a similar disease, but a very simple way to think about it is lymphoma is generally a cancer that's involving kind of lymph nodes or parts of the body, whereas leukemia is a similar cancer process, but it's involving the blood.
Does it travel via the blood into the lymph nodes? Is that how that works?
So the way I explain it to patients is that your body's blood system is made in your bone marrow, and it has white blood cells that fight infection and red blood cells that carry oxygen. You know, those get low and people are said to be anemic. And then it has platelets that help the blood clot when you get hurt. And the white blood cell system, its job is to find infections, fight those infections. If those infections were to come back, be ready to fight them in the future. And it requires literally an army of cells to protect you. So some of those cells are like the attack dogs. Like when there's an infection, they're ready to use their, whatever vehicles they have, their chemicals, their snipers to go ahead and kill the infection. Other ones gobble up infection, literally, like surround them and gobble them up into their cells. And other cells are involved in coordinating the immune response. And the lymph cells are the cells involved in coordinating that immune response and remembering those infections for the future. And even amongst the lymph cells, there's lots of different groups of cells, and any one of them can grow on their own when there's not infection or inflammation and develop into a cancer. And so some of those cells are baby cells that first arise in the bone marrow that really haven't learned very much. They're like infants, and then as they grow a little bit older, they gain and lose certain properties that differentiate themselves. And as they get older, they gain and lose more and more properties. And each of those phases is a different phase in the lymph cell development. And the cells can stop growing up at any point in that. And if they stop growing up in a very early phase, in the bone marrow phase, then they become a leukemia. They're blood cancers that are predominantly in the bone marrow or the bloodstream. And if it's at a later phase, they often become a lymphoma, which sometimes can be in the lymph nodes, but because those cells regulate the immune system in lots of places in the body, and people can get infections in lots of places in the body, they can be in other parts of the body like the lung or the skin or the liver.
I gotcha. So that's why that mass was up against his lung.
Exactly. Yeah, he had a big group of lymph nodes that were enlarged or abnormal in his lung in the middle of his chest.
Older cells that later developed and formed together leaning against that lung, right?
Exactly.
How proud of you. How proud of yourself are you right now?
I'm very proud that I followed that and know exactly how to now treat lymphoma and leukemia.
Right.
You guys can just reach out to me whenever you need me from now on.
So it's lymphoma is not a cancer that is relegated to the lymphatic system necessarily. It's more of a cancer that is just come late stage and is affecting lymphatic cells.
Yeah, it comes from those lymph cells. And there are more immature lymphomas and more mature lymphomas. And in fact, there's over 90 types of lymphoma.
Wow.
And so Justin had Hodgkin lymphoma, which is one type. But then all the rest of them are basically called non-Hodgkin lymphoma, of which there's many, many, many types.
Gotcha. Because we were wondering yesterday about what's the deal with Hodgkin? What's his deal?
I was joking. Who's this Hodgkin's guy and what's his problem? I mean, wouldn't that just be the worst if your contribution to medical science was having a horrible cancer named after you? Like, where does Hodgkin's come from?
So Hodgkin, the word Hodgkin came from the person who first discovered or named Hodgkin lymphoma.
Okay, so he didn't have it, he discovered it.
He discovered it.
So now that's better.
Yeah.
See, I still wouldn't like that. Like, if I was Hodgkin's, I would be like, can we name, like, the treatment after me?
Right.
Like, not the cancer?
Right.
But then Hodgkin's is the first lymphoma to be cured with radiation. It was amongst the first cancers ever to be cured with chemotherapy. And the advances in Hodgkin's have outperformed, I think, a lot of other diseases. So I bet you he's pretty proud of himself.
I was going to ask, did any of that happen during his lifetime?
I'd have to look that up.
I hope for his sake that it did.
Well, I really like that you saved his face. Patrick was dogging him, and you really saved face for Hodgkin.
I was empathizing.
I think Hodgkin would be very proud, and I think you're right.
He should be.
That's right.
He should be.
So that's interesting. When was it first Dr. Thomas cured with radiology?
So that would have been many decades ago.
Okay.
So, back before we really had very effective chemotherapy or before we knew the right chemotherapy to give for this type of lymphoma, because very early on, there were kind of very few regimens and, a lot of things were grouped more together rather than more, specialized cancer types or even individual subtypes within Hodgkin lymphoma were all treated similarly. So we kind of had very simplistic approaches to a lot of cancer types. And so since there wasn't great cure rates with the known regimens, radiation was effective, but we did have to, at that time, treat a very large part of the body to a very significant dose, which has its own side effects. So even though it was a potential way to cure the lymphoma, as things progressed and more effective chemo regimens were identified for lymphoma, that's actually kind of swung the pendulum back in the other direction, where now we can pull back and kind of selectively use radiation only when it's absolutely necessary, and also just kind of selectively treat the areas that are most at risk and to a lower dose. So it's really kind of been a nice kind of story where things have kind of evolved over time to where there's a better balance where we can use the two of them together or separately when necessary.
Thanks for listening to This is Cancer, brought to you in partnership with Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
For more information on Siteman Cancer Center, go to siteman.wustl.edu. Be sure to leave a review and like and subscribe wherever you listen to podcasts.